What is CIN after abnormal cervical cancer screening? Have you ever wondered what happens after an abnormal cervical cancer screening? One important term you might hear is CIN, which stands for cervical intraepithelial neoplasia. This term describes abnormal changes in the cells on the cervix's surface. These changes are detected after a cervical cancer screening and confirmed by a biopsy. It is crucial to understand that CIN is not cancer itself but rather represents precancerous changes that could develop into cervical cancer if left untreated. CIN is graded on a scale from 1 to 3, based on how abnormal the cells appear under a microscope and how deeply these abnormal cells extend into the cervical tissue. CIN 1 indicates low-grade changes. This means there are mild abnormalities affecting about 1/3 of the thickness of the cervical lining. The good news is that these changes often regress naturally without treatment. The immune system can usually clear the underlying cause, which is often human papillomavirus. For CIN 1, monitoring is typically recommended rather than immediate treatment. CIN 2 indicates high-grade changes. This involves moderate abnormalities that affect up to 2/3 of the cervical lining. CIN 2 has a higher risk of progressing to cancer compared to CIN 1. For this grade, treatment is usually recommended to remove the abnormal cells. However, in some cases, careful monitoring with repeat biopsies may be an option, depending on individual circumstances. CIN 3 indicates severe abnormalities. This grade affects the full thickness of the cervical lining and carries the highest risk of progression to cervical cancer. Typically, prompt treatment is required to remove or destroy these abnormal cells to prevent cancer development. The detection of CIN usually follows an abnormal Pap test or HPV test during cervical cancer screening. A colposcopy, which is a detailed examination of the cervix, and a biopsy are performed to confirm the presence and grade of CIN. Treatment decisions depend on the CIN grade, the patient's age, pregnancy status, and other clinical factors. Treatment options for CIN aim to remove or destroy abnormal cells to prevent progression to cervical cancer. These treatments include excisional procedures, which remove tissue, or ablative methods, which destroy tissue. Low-grade CIN often resolves without treatment, while high-grade CIN is generally treated to reduce cancer risk. In summary, CIN after abnormal cervical cancer screening indicates precancerous cervical cell changes, graded from mild to severe. Proper follow-up and management are essential to prevent progression to cervical cancer. This makes early detection through screening critical in reproductive cancer care. If you have concerns about your cervical health, it is always best to consult with a healthcare professional for personalized advice.